Okay, I think we're going to get started as others join, but welcome. Good morning, good afternoon, good evening. I know we're covering many time zones here, so glad that everybody could make it. If you're here for the webinar, Mobilizing for Global Access to Vaccines, #for a Future, then you are in the right place. So welcome all. We are recording the session, so just to note, few housekeeping rules. If you could keep yourselves on mute unless you're talking during the question and answer portion, that would be great. And if you have any difficulties at all on tech or want to ask any questions, you can do so in the chat function. But to get us started, my name is Taryn Russell. I'm the Acting Executive Director at Results Canada. If you're not familiar with Results, just want to give a little bit about us. We are a grassroots advocacy organization with the mission to create the political will to end extreme poverty. And since our founding nearly 40 years ago now, we've always recognized the strong intersections between poverty and health. So we all know that poverty is both a cause and a consequence of poor health, and we remain committed through our advocacy to pushing for quality health care for all, which is why we're here today. But before we begin today's session, I would like to pay respect to the Algonquin people who are the traditional guardians of the land where the Office of Results Canada is located, which is in Ottawa, where I am. We at Results Canada acknowledge their longstanding relationship with this territory, which remains unceded. These peoples have lived on this land since time immemorial, and we are grateful to have the opportunity to be present in their territory. And this conversation about access to immunization, particularly among the most isolated and marginalized communities, is not unrelated to the historical and current reality of Canada's Indigenous people. So we know that colonization exposed Indigenous peoples to diseases against which they had no acquired immunity and which continue to affect them disproportionately. Their experience of non-consensual treatment and medical experimentation also caused trauma, which is an immediate link with the mistrust of Western health systems and medicine today. So why don't we keep that in mind as we go on with today's discussion? So our webinar today marks the official kickoff for Results Canada's campaign, #for a Future. And I've said hashtag twice now, which I think is also our comms team wanting to make sure that if you want to engage on social media, you could use the #for a Future to continue the conversation. And so over the coming months, we are going to be advocating for financial support from the Canadian government for global immunization efforts. And we're not doing this alone. Advocates around the world, health workers are also going to be pushing for their governments to be investing more in immunization. And why? We're going to hear a lot about that from our panelists in the discussion today. But generally, immunization is one of the health interventions that has made such a tremendous impact in terms of the ability for both children to survive and thrive. Immunization accounts for much of the progress that we've made in reducing child deaths under 5 by more than 50% since 2000. And I know we hear a lot of negative headlines in the world, and there's a lot of things we want to address, but I think this is a really good news story that we continue to lean into in terms of successes that healthcare interventions like immunization can have. And if we're successful in our campaigning and pushing donors like Canada and other governments to continue to support the work of global health initiatives like Gavi, the Vaccine Alliance, and the Global Polio Eradication Initiative, then we're going to be well on track to seeing that number reduce even further and to also hit other important milestones. I'm very happy today to introduce our panelists who are doing tremendous work in delivering and advocating for quality healthcare, including immunizations in their communities around the world, often in very complex and challenging circumstances, and many of them are joining it late in the day, so just a huge thank you to that. So I will take the time to introduce them before we jump off into the discussion, and then you'll have time to answer questions as well. So first, I will start with Mike Mulongo, who is a medical doctor and Mandela Washington Fellow with over 10 years experience in healthcare delivery, entrepreneurship, and management. He's helped develop global, regional, national, and subsector guidelines on health financing and system strengthening, as well as primary health. He holds a bachelor's degree in medicine and surgery and an MBA in healthcare management. He's joining us from Nairobi, Kenya, where he is WACI Health's health financing advisor. And he recently wrote a report on regional immunization and progress towards transition, which would be great if you could all check out. So welcome to Mike. Next, we have Debbie Nuatin, who's the Assistant Chief Hospital Administrator and Human Resources Officer of the Department of Community Health and Primary Health Care at Lagos State University Teaching Hospital in Nigeria. So she's an advocate that promotes immunization. She engages with parents in remote villages to educate them on the importance of immunization and physiotherapy for children with disabilities. And last but certainly not least, she's also a polio survivor, so is an advocate in her own right. So huge welcome to Debbie. Next, we have Mohammed Jassim, who's trained as a cardiologist in Syria. So he started working in public health when war and then a polio outbreak flared up in his country. He became interested in vaccinations and worked with refugees and victims of war. He's now based in Turkey, and he leads the Early Warning Alert and Response Network and immunization team of the Assistance Coordination Unit. His NGO works in northern Syria, where they detect vaccine preventable diseases to stop transmission. So welcome, Mohammed. And then last but not least, we have Rita Rayam, who is the holder of a PharmD, an MBA in health management, and a master in gender studies. She joined Gavi, the Vaccines Alliance, which I referred to earlier, in September of this year, and is head of equitable immunization programs. Prior to joining Gavi, she was the health and HIV advisor for Caritas International and president of the Sphere Board. She's also served as the Director General of Caritas Lebanon and was a lecturer in public health and emergencies at St. Joseph University in Beirut. So you can just see the amount of expertise and that we have here today. So really excited to be hearing from them. The discussion is going to be moderated by Results Canada's very own Dominique Denoncourt, who's the Policy and Advocacy Advisor and is leading on our work on immunization. So with that, I'm going to pass it off to Dominique and we'll get this discussion underway. Thank you very much.
Thank you, Taryn, and thank you to all our panelists for agreeing to share your perspective today. I feel very lucky to have a chance to share the screen with you today. So we invited you to join this panel because you all have different expertises and different perspectives on immunization. To help our audience get to know you better and to kick off our discussion, I'd like to ask you a first question, and I'll start with Rita for this one, and then go to Mike. Can you explain in 3 minutes, why do you believe immunization to be one of the most impactful interventions in global health? You can refer to your professional experience or share a personal story if you prefer.
Thank you, Dominique, and good day, everyone. It's a pleasure to be here with you and pleasure to be part of this discussion. So I will definitely not only say that immunization is a cornerstone of public health, which we already know and believe, but I want as well to bring the lens of Gavi that over the 24 years, we've managed to vaccinate over 1 billion of children in developing countries. And I think let's reflect not on the numbers, let's reflect on the life that we have saved. Let's reflect on the future deaths averted. And I think this is the importance of immunization. If we're going to look into the importance of immunization, it's prevention. We're heading towards climate change, towards many outbreaks. It's immunization. If we are going to look into the cost effective, it's immunization. If you want to look further beyond the individual to the community, to the herd immunity, it's immunization. So you're not only protecting yourself, you're protecting your community. You're making sure that we're giving every child the chance and the right to live. And this is immunization. Definitely, we're not saying that we're there yet. It's a longer journey, but we have been able to reach missed communities, many under-immunized children. But again, to say as a conclusion, it is the best way of bringing or supporting people, and it is the best way of feeling that you're making a change in everyone's life. Throughout my previous experience, immunization has played an important role, not only in developed countries, but as well in fragile and conflict settings. The numbers of preventable diseases that we were able to prevent in refugee settlements, during migrations, in conflicts, the number of children that we've been able to save, even on a very good day and in very developed countries. So I think this is the power of immunization, saving lives, bringing the health experts together, bringing the health system together, and making sure that health workers and everyone within the health system is contributing to saving lives. Thank you.
Thank you, Rita. I'll ask Mike and then Mohammed and Debbie. Mike, why do you believe that immunization is one of the most impactful interventions?
Thank you very much for the opportunity as well. And the question on why immunization is the most impactful, I think looking at the context, for instance, looking at the context of low and middle income countries where you have a lot of income inequalities, where you have so many other issues that befuddle the basic right to life. The reality is that immunization in itself and vaccines help save lives, number one, not just at the individual level, it also works towards the population, as it were. It allows every child to have an opportunity to maximize their potential. You look at, for instance, indices like the Human Capital Index. You notice that for countries that have a lot higher scores as far as the Human Capital Index, you also notice they have high immunization coverage, as it were. So to that extent, immunization not only helps at the formative phase of a life, it also works towards improving capability and also improving productivity at the population level. And the other component that is notable is just from the recent impact of the COVID-19 pandemic. Vaccinations help work towards global health security, ensuring that not just the individual is safe, but the population and the world at large is safe. So that's why I would say that one, it saves lives. Two, improves productivity. Three, contributes towards global health security. Over, and thank you very much, Dominic.
Thank you, Mike. That was very clear. Over to you, Mohammed.
Thank you very much. Thank you, Dominique, for this opportunity. I will not go far. I will discuss my story with immunization. It was started from 2013 when I was a cardiologist and I forced to leave my specialty to another place because of the war and conflict in my area. There, I started working in the community with the victim of war and IDPs. With my colleagues, we established a surveillance system where we got a training from CDC. After 3 months of this, time, we detected a polio outbreak in my country, which was free polio for more than 10 years. That was because of the suspended of vaccination services in my country. 1 year have been suspended, and then we have polio outbreak. We didn't face polio cases in our, experience as a doctors. In that moment, we again created myself as another team, and we started vaccinating the children under 5 years, and we did polio campaign. In 6 months, we could interrupt the transmission of polio. We did everything, but in that moment, again, we faced another problem. We faced massive number of outbreaks, massive cases of measles. We faced measles everywhere, in every house. I remember in 2014, there is a full village infected by measles. We didn't face before measles cases for 20 years, 50 years, 60 years. And sometimes we met all the villages infected by measles. And after that, mumps, hepatitis. In that moment, we feel how is important to refertilize the vaccination system. And together created another team, SIG, and we refertilized the EBI centers, routine immunization centers. Now, after 10 years of war, we have vaccination system and we have stable surveillance system. The conflict in our country still continuing and the situation bad, but in another place we have stable vaccination and surveillance system. We don't have this number of outbreaks. We have sporadic cases, but because of this organization and this efforts, we don't have this situation again, the situation like 2014 and 13. But again, we will face another challenge in the next year. We will have shortage of fund for the systems, and I hope from my place and my position that we will not face again the situation in 2013 and 14 because of the lack of fund. That's my experience with immunization. It's practice experience. When we lack the immunization for 1 year and we get back for more than 20 years because of this harm in the immunity barrier of the community. Thank you very much.
Thank you, Mohammed, for sharing your story with us. Debbie, from your perspective, why do you think immunization is one of the most impactful interventions in global health?
Hello, good afternoon. Good morning, everyone. Yeah, I work in health field in immunization clinic as an administrator. So I've seen healthy babies that are being immunized. I see unhealthy babies that were not immunized that were brought to the hospital for emergency purposes. So because I'm a polio survivor, I contracted polio as a baby, and I had massive support from my parents, my late parents. They are late now, and they didn't hide it. They gave me education. Although because of disability, I was delayed in starting my elementary school. But despite all the challenges, I was able to complete education. Now I have my master's degree certificate. I'm a graduate, I'm a degree holder, master degree holder. So I have been going to, because of the field I find myself working in immunization clinic, I've been advocating for importance of immunization because I'm a survivor, and they can see through my success story that immunization is very, very important. So I had advocacy with the mothers. I engaged with the mother time to time during their clinic days, advocating for the importance of immunization. Some of them, they ask questions. I go to the remote area, especially the village where I grew up, because they were not enlightened. That was why I caused polio. I go to the villages, including the villages I grew up, to educate the mother, to enlighten them, because some of them feels that immunization is very expensive. They don't know that it's cost-free. And because of the place here in Nigeria, some of the primary health care centers, apart from the villages, so some of the women, the mother, can't access because of transportation costs, poverty, all those challenges, made them to go for a traditional way of treating their children instead of immunizing them. So most of them, like my mother, lost so many of her children, about 6 or 7. I happened to be the only survivor, and I had polio, I had disability. So because of this prompts me to advocate, because I've benefited, I've seen people that benefited from immunization in my field, healthcare field. I've seen healthy babies, I've seen disabled babies. So I'll be advocating that it's cheaper to take immunization because it's cost-free than having a child with disability or child that is not useful to you. Like I go to physiotherapy department as well to encourage mothers with children with disability, because some of them don't even bring out their children for immunization. They don't believe anything good can come out of these children. I use my story as an example to encourage them not to give up on the children. They should bring them, make sure they start their immunization process routine and completion. That's what I'm advocating for. Because some of them, you actually start the immunization routine, they don't complete it. They don't see the necessity to complete the immunization. And some immunization routine are multiple doses. Some are 4 doses, some are 3, some are 2, some are single doses. So I advocate that completion, and not only to know about it, they should go to their various communities to tell other caregivers, mothers, the importance of immunization, people that are not aware. So, and another thing that I know that is very prevalent among us here, they believe that when you come to the city, that's where you can access immunization, vaccination, routine vaccination. But I told them you can go to the remote area, their primary health care center. If you said immunize vaccination everywhere, there is no fake vaccination, there is no original vaccination. So they should not be discouraged. They should go to other primary health care centers and make sure they vaccinate their children. Make sure they vaccinate, continue advocacy, and which I have been doing. Continue advocacy. At times I do door-to-door campaign about the importance of immunization. I go to my village because I can communicate in my language, because language barrier is another challenge. I communicate with them with my language importance. Thank you.
Yes, thank you, Debbie. And thank you for sharing also how surviving polio influenced your work today. And the story that you were just saying about mothers and community and how you raise awareness, it brings me to another question that I'll have for you in a second. So right now we've heard our panelists talk about disease prevention about how vaccines can prevent diseases that sometimes we think are very far from us, about community resilience, and about how vaccines help to maximize opportunities, right? To only name a few aspects. But now I'd like to tap into all of your areas of expertise to understand how you each contribute to closing this immunization gap. So I'll start with you, Debbie, and follow in the opposite order to our first question. So all those questions could be the topic of a webinar on their own, of course, but unfortunately, since our time is a bit limited, we'll explore these topics briefly. But no worries, the question period will also serve as a time to further develop on these points. So Debbie, many zero-dose children live in remote and rural communities, as you mentioned. The physical access to these communities is challenging, but also the logistics of delivering vaccines to them. It's a challenge for health workers. In fact, this is one of the major challenges holding back polio eradication, as I'm sure you know. So how do you effectively reach communities, both physically and pedagogically? And by that, I mean, how do you raise awareness with communities? I think you've answered that part, but the physical access, how does that happen?
In terms of physical access, there have been a lot of challenges reaching all these communities physically because of road network. We don't have good roads in my country, especially to get to all this remote area. Security reason has been a major challenge because that is depriving the health workers to go to all these communities to access to take vaccine to them. Security has posed a lot of challenges in this part of the country because at times some of them were robbed, some of them were kidnapped, and all those things has posed a serious challenge on health workers in reaching all these communities. Then, because finance is another aspect, because immunization process is not well funded by the government. It's not well funded, and the health workers are not well paid. So they are leaving the countries to go to other countries where they will be well taken care of, and there is security, and they will be well paid. That personality has been a great challenge in this part of the country. Another thing that posed a lot of challenge in getting up to all these remote areas to get the children vaccinated is to get the vaccine across to the children, to the community, because of the cold chain. At times, all these communities, they don't have electricity to power their vaccine refrigerator. So the health workers, they are forced to use ice pack with ice cooler to take vaccine to all these remote areas. And because of transportation, anything could happen. Maybe the ice pack melts away, or the potency of the vaccine is not all. At times, the children can be vaccinated, but they are not immunized because of the potency of the vaccine. Some of these remote areas, although some of them have inverter-free vaccine fridge, which at times is not well maintained by the government. Some of them have generators. Fueling the generators has been a challenge for them too. So most of the time, even when they get the vaccine, the potency of the vaccine is not okay. And the vaccine have a degree that to make that degree that potency can maintain from 0 degrees to 8 degrees. Once that potency is not maintained, the person can take vaccine, but the child is not immunized. The child can take the vaccine, but it's not immunized. So that has posed a lot of challenges to which I'm advocating what the government, the NGOs, the support countries should invest more on immunization program, especially for the underdeveloped countries, so that the children can be well immunized appropriately.
Yes, thank you, Debbie, and thank you for explaining how it is not only the geography, but also the cold chain that poses a challenge. This is something that a lot of people don't know. It is important to mention. Did you want to add something?
Yes, I think in terms of awareness, in this part of the country, there are some certain communities, they don't believe they are vaccine resistant. They don't believe in vaccine. There is nothing, they believe that vaccine is just salt water you put in the bottle. They believe that it's just ordinary water. So some of these communities, the way my team and I have been able to penetrate, we engage the community leaders, the opinion leaders, the market women, the market leaders, to advocate the importance of immunization, to convince them, to wipe away their misconception about immunization, so that they can go to the community and encourage them, because they believe in all these leaders. They hear them, they live with them. So before we can penetrate, we have to engage all these people, set of people in the program before we can have a successful advocacy program. So we use community leaders, volunteers as well in the immunization process. Volunteers, women, some of the women volunteer, like polio that is oral, some of the women volunteer to administer the oral polio. They go into the community, they do door-to-door advocacy, and they go help in the immunization process. But it's obviously not free. Some of them we have to give them incentive to be able to carry out this work. At times we have outreaches for the mothers to tell them it's not only outreaches on immunization, medical outreaches to also advocate on the importance of immunization. And at times where healthy baby is given an award, like a gift, a souvenir or something, to encourage other mothers to bring out their children, to immunize them so that they can look healthy. They can be showcased in the programs as well. So it's not only, we have other outreaches program, medical outreaches on immunization as well, to advocate the importance of immunization. Thank you.
Yes, thank you, Debbie. Yeah, it's true that it requires. I think I was muted for a second. Okay, sorry. Am I muted? Can you hear me?
Yes.
Oh, okay, okay. It was written that I was muted. Sorry about that. Yes, okay. Thank you, Debbie, and thank you for mentioning the role of different actors to reach the communities that are far from city centers. Mohammed, although you work in a different context, I think that there are similarities within your work. How is immunization and disease surveillance rolled out in fragile and conflict-affected contexts?
Okay, I think immunization and disease surveillance in the fragile and conflict-affected context is challenging, but it's very crucial to do for the immunity of the community. I think there is three main, component or things need to need to do or to put like a guide how to establish the immunization and surveillance system in the fragile areas. The first thing is flexibility and adaptation. We know that there is general rules for the surveillance and for the immunization, and so it's guides and SOPs, but there is no anything fixed. For example, I will give an example. We don't need to do very detailed or complicated surveillance and health information system. It's enough, for example, to do early warning alert and response network like in our situation. And after that, building the capacity for a team and after 1-2 years, cover very comprehensive information system. For example, we can use it for first aim mobile teams, not fixed teams. It's lack of flexibility and adaptation. Every case, it's not like other cases. It's the fragile context is very difficult to work there. The second thing, it's very important, is coordination between the national NGOs, international NGOs, and UN agencies and donors, and community engagement. Together, only together, we can do the vaccination and surveillance system. nobody can do that because if somebody have fund, he don't have access, and if somebody have access, another have the capacity. We should sit together and build the proper team or the proper module for every situation. The last thing, and very important, I think, it's sustainability. When we planning to do surveillance and vaccination activities, we shouldn't plan that for 6 months or 1 year. At least we need 3 years, because for example, I didn't saw any conflict in my region at least finished in 6 months or 1 year. The conflicts don't depend on the situation, the humanitarian situation. And sometimes the humanitarian situation affected by the conflict more than duration of the conflict. Sometimes they are affected for 10 years or 20 years. I think at least we should have plans for 3 years minimum for any plan to establish the immunization and surveillance system in fragile area. Thank you very much.
Thank you, Mohammed. I think that flexibility, coordination are really the key words of what you said, and sustainability, right? And those reflect really the most important concepts of international aid at large. So easy to keep in mind. But to minimize the impact of crises, but also to prevent them, it is important that for countries to benefit from strong health systems. And that is easier said than done, of course. Mike, you've written reports about this, including one quite recently for Waki Health, Result Canada's partner in Kenya. So what are the challenges faced by countries that prevent them from investing sufficiently in their health and immunization system? And how do you advocate for increased commitments in this context?
Thank you, Dominique. So the question is what is hindering countries from prioritizing immunization? And a few things. I mean, the conversation can be long, but I'll just touch on a few. One is on the public finance context, and the second is on the structural context. And these two, you will notice, are largely influenced by politics. I'll go back to the first one, the public finance context. You will notice, like from the report you're talking about, we're looking at 10 countries within the African Union. And what we noticed is that if you're looking at just the broader public finance context, how they mobilize resources, how they spend those resources, and how they account for those resources, not specifically for health or immunization, but just broadly as an economy, you notice that most of these countries have high debt levels. High debt levels, using the threshold of 60% of GDP. You have countries that, for instance, like Mozambique, whose debt level is at some point was more than 120% of their GDP. What that means is that for every resource that you mobilize, you're paying out a lot more for debt in terms of debt repayment. What that means is that you have very little resources left for you to prioritize for any public sector priorities, whether it is health, whether it's education, whether it's security, agriculture, name it. So one is high debt levels that to a great extent are debilitating, number one. Number two of the public finance challenges is we notice that most of these countries are not mobilizing adequate revenues domestically through taxation. So weak taxation systems, or weak tax administration that do not incentivize tax payments, as it were, or are not deemed to be fair, to a great extent also affects the amount of resources that are available, not just for health, but also to be channeled to other sectors and ultimately towards immunization. An example worth mentioning is that, the global threshold for tax adequacy is 15% of the GDP. A good number of the countries within the cluster that we were analyzing were mobilizing less than that, way less than that. I see Debbie's here. Nigeria was mobilizing 7%. of its GDP in taxes. What that means is that then if you're not going to borrow, then you're going to depend on donors to supplement that, yeah? And to that extent, then, and then you also have other competing interests. If you're using, for instance, let's speak to Nigeria as it were, the northern part, you have conflict. Let's talk to Mozambique. The northern part, you have conflict. You're also suffering or recovering from natural disasters. They also had 3 typhoons in quick succession. So when you have minimal room from your domestic resources, either because you're not mobilizing adequately through taxation, or you're not, or you're deeply in debt, then you will struggle to finance health, because it's from the health basket that you finance immunization. Then the other bit is, yes, you have mobilized. Then you also have a lot of wastage through weak public finance system. So you end up with a lot of wastage through corruption, and that takes away from the very little that you already have. So those are some of the public finance components. And you're looking at now the budgets that come towards health. So yes, you've struggled with debt, you've struggled with less tax, you've struggled with wastage. Then also when it comes to the budget's allocation to health, because it's from health that you get immunization financing, then you also notice that there is very low prioritization of health. Most of the countries that we analyzed were allocating less than 5% of their GDP towards health. What that means is that health has multiple priorities, whether it is communicable and non-communicable diseases. So you will notice that because you have a small basket from which you're drawing, then very little will trickle down towards immunization. Then when it comes to immunization itself, given all the other factors we've mentioned, you notice that even the allocations to immunization are very low. Significantly so that you have significant donor dependence. A good example is, for instance, on average, for the 10 countries, the countries we were analyzing were only funding 25% of their immunization budgets. So to that extent, that then becomes a public finance challenge. I will stop there. We will come back to the rest later. Over and thank you.
Thank you so much, Mike. We will share the report in the chat so that people can read more about this. Now, Rita, the issues faced by countries when developing their immunization platforms and the difficulty to make them sustainable, especially in a context like this is something that Gavi's model is designed to address, right? So can you tell us, Rita, what is Gavi's approach to health system strengthening and how does it contribute to reaching zero-dose children?
Thank you, Dominique. Gavi's mission or vision is to leave no one behind. So basically, what we are doing is supporting countries to develop their and to strengthen their own health system. And by doing so, we're really clearly saying that it is every support is driven by the countries, is led by the countries, is community owned, is sustainable, is placing these communities at our first priorities. So what we are doing is basically supporting countries to reach under-immunized and zero-dose children. And what do we mean by this? Is not only helping countries to identify where they are, but to understand why they are missed communities, why they are under-immunized, and basically develop a response that fits the local culture, the local context. We do not provide one solution that fits all the problems. We adapt our approach to the local context. Same as making sure that we're supporting a stronger PHC platform so that we can reach zero-dose children even at the last mile. We're looking into how we're supporting countries to build an immunization services that are resilient, well-managed, harnessing innovation, catering to the needs of the caregivers. And I know that this is a long sentence because it can be detailed in many things. So one of the examples are, for instance, innovation. We've heard Debbie discussing how it's hard to reach mixed communities and rural areas. Innovation is helping us not only from a digital perspective to have a micro-planning, to be able to have a real-time evaluation, to be able to have a GIS micro-planning, understanding where the mixed communities are, but as well as harnessing the innovation in order to move, for instance, from multi-dose vaccine to one-dose vaccines that will help community health workers. We will focus on the cold chain, and again, the examples is really amazing. Yes, there's a lot of progress that is happening here, and this is Gavi's role in order to make sure that this reach the country level and it is sustainable. But as well, we're making sure that we're building the capacity, we're supporting API managers. As Mohammed has described in his example of polio, API managers, the health system should be ready for any outbreaks, but should be as well able to bounce back after any outbreaks, such as COVID. We have seen many countries who have done an amazing job, other countries who have seen now backsliding, but they are going back to the previous norm and much more above. So how we're supporting API managers, making sure not only the API managers, the community as well, the health workers are really supported with the skills, the competency needed to make sure that once countries are transitioning out of Gavi, they are still sustainable and they can move forward. It is important as well to look into how we're helping countries to build a resilient demand and tackle and identify gender-related barriers. What does it mean? Communities who do not want to be vaccinated. Gavi has given as well an example of this, understanding the local culture, understanding the behavior so that our responses are targeted, making sure that we're removing all the gender barriers that are faced by healthcare workers. We know that there are 70 to 80% are women, to remove the gender barriers that are faced by mothers, by caregivers, by adolescents, but as well making sure that, as Mohammed has said as well, bringing everyone together within the country. So we're not doing this alone. It's a country-led, and we're making sure that local CSOs are there, their voices are heard, and we're as well making sure that we're learning at the same time. Our response is different. We're working in fragile and conflict settings. We're working in middle-income countries. We're working in high-impact countries where the number of zero dose are really high. So making sure that our response is targeted, country-owned, and respecting the local context. Thank you.
Thank you so much, Ruta. Gavi's recent investment opportunity shows that it works in the long term too, right? I think that it's 19 countries that have graduated out of Gavi support. So yes, there is this aspect of sustainability too that can be reached. This conversation has been very, very insightful so far. So we'll open the floor now for a couple of questions. We can start with 3 to 4 questions and see how much time there is left. I don't know if there are questions in the chat yet, but if not, now you can just jump in and open your mic and ask your question. Please make sure that you keep your questions and answers brief to give a chance to as many as possible to participate. I do have a question in the meantime. I was wondering if you've seen or developed yourself innovations that help tackle the challenges linked to immunization in hard-to-reach areas, like technological innovations, for example. And it's open to anyone, really.
Well, I will venture there and say definitely yes. And this is one of the role as well of the private sector in supporting this kind of innovation. We have seen, as I described, the micro-planning using data, analyzing data, but definitely the role of AI, which is getting much more traction in terms of working in immunization, providing healthcare workers in the remote places with all the support needed. We've seen that sometimes training is taking the health workers out of the primary healthcare centers, and in some places there's probably one person in the healthcare center. So how are we bringing the training to the healthcare workers everywhere? How are we making sure that we're bringing this peer-to-peer learning between countries as well, which is really important. So leveraging all digital innovation to make sure that as much as possible, we're supporting the countries. And I think it's definitely we're going to see progress. If we look back where we were and now where we are, I'm definitely confident that especially when there will be immunization really at the center of our work. So definitely bringing more innovation into the immunization sector.
Thank you. That's super interesting. I'll look it up. I think we're starting to have some questions in the chat. Yasmin, do you want to ask them?
Yes, of course. So the first question is also for Rita, a little bit kind of building on, your previous answer and talking a little bit more about, Gavi's collaboration with other global health initiatives. So, so Ekta just asking if you could maybe give some more examples of how Gavi collaborates with and, just kind of fits into the work of other global health initiatives such as GPI, just in order to kind of maximize the impact that they have. Yeah.
Thank you for the question. Definitely, as Gavi, we're collaborating and with everyone at the global health level, especially after the Lusaka agenda. So not only at the global level, the collaboration is taking place at a country level. So when there's any initiatives or when there's any campaigns or anything done by GPI, and we can work together, this is happening at the country level. I think we're more and more bringing the role of we're more and more finding how collaboration is really important with leveraging existing resources, learning from each other's. This is something really important. We've learned a lot from the polio, the vaccine, what they have done, what they have learned, and it's an ongoing coordinations that are taking place at the different levels. Thank you.
Yeah, that's again just really amazing to hear about those, and thanks so much for answering that question. And moving on to another question, we are getting a couple more, but maybe I could direct this one to maybe Mohammed. So Bernice is asking about some events that have maybe motivated you to have such a strong passion for advocating. So this could be kind of personal experiences or some things that you've participated in. And just throughout your advocacy journey, kind of what shaped that specifically?
The question, what motivates me to work in the organization? I will say it's a short story. My team informed me that I should receive a sample in the community. I received the sample in afternoon time. It was war, but when I received this cold books, I asked myself why I'm doing this, and crossing the border with this books. But finally, I decide, and I went and I crossed the border between Syria and Turkey, and I went with the sample to Ankara. I think I dispatched some samples from Syria to Ankara to see what's in the samples. I think one of the samples was the first polio case in my country. From this point, I feel what I did. We detect the polio in very early time, and after 6 months, we could interrupt, the transmission of polio. I think after this moment, I serve my community as health worker more than my real specialty as cardiologist. The small thing what I did, I think saved a lot of lives as a community health worker or public health worker in this very conflict situation. And from that time till now, I cannot go out from immunization and surveillance.
Yeah, thanks so much for, again, just shedding more light on that. And, it really is always, great to just hear about personal experience and, advocacy, because it really is, it can be so personal. And I see that we're kind of, getting to the end of our time. So I think I'll just take one more question. I, again, really, really appreciate all of you asking questions in the chat. Maybe I will direct this one to Mike. So yeah, so we have Tina just asking or mentioning that they appreciate the mention of multi-year funding for surveillance and vaccination programs and understanding the role of debt and allocating resources to public health services. Yeah, and so I guess the question is, what advice would you kind of give on communicating to G7 countries when it comes to taking actions tackling, countries' indebtedness so that, lower to medium income countries can invest in the health of their populations? Yeah.
Thank you. Thank you, Tina, for that question. I think it's a broad question around debt management and debt sustainability, and the impact it has on financing, say, health and immunization. So and this really is not just the prerogative of the G7 or any other multilateral entities that offer debt, as it were, but there's opportunity for that collaboration between countries and the lenders, as it were, to renegotiate. So flexibility as far as debt repayment is concerned, so that then either the rate or the tenure of the debt is negotiated for purposes of just allowing manageable repayments, as it were, in the event that then debt write-off is not a consideration. That's one. The other component is, and this is a conversation that is being explored around innovative approaches to managing the debt in terms of debt swaps, so that then instead of the cash repayment, and that be plowed back into, say, immunization, earmarking that towards immunization. So the conversation here would be around flexibilities in repayments, and approaches for, say, for instance, innovative management of those debt, as it were. But it's not solely a responsibility of the lenders. It is a collaborative engagement between the lenders and also the countries that are in debt, as it were. Over, and thank you.
And thank you so much for providing some more insight about that. And I think it's always kind of great to talk about that aspect, because that might not be something that people always think of immediately, but it is always, kind of informing the work and the research with that. So I guess maybe I'll just do one more question, very quickly. Again, I just think it's so amazing to see how engaged, our attendees are today. So just, kind of the question about how Gavi prioritizes which vaccines to support in different regions, and what technology is being used to improve the delivery and the coverage of vaccines. So maybe I guess I'll redirect that back to Rita again. Yeah.
Thank you. We basically, the request comes from the countries. It is not up to us to prioritize which vaccine. It's not up to us to decide which transportation we need to use. So it is led by the countries. It is up to us to support the countries to get the needed tools, for instance, if they need the tools, so they can look into the portfolio and better have a better use the portfolio, or use the tools to decide on which vaccines. But it is definitely not up to us. Thank you.
Thank you so much for providing more insight. And and again, thank you all for answering all these questions. And it's just been really amazing to get more insight about the work that all of you are doing, and just your personal advocacy. So with that said, I'll pass it back to Dom for our closing remarks.
Thank you, Yasmin. And sorry that we couldn't answer all of the questions. That's the challenge of a lunchtime webinar. But what I can do is to pass them on to our panelists after the webinar and make sure that you get an answer. So we will soon be wrapping up already. But before we close this event, I'd like to ask our panelists to say in a few words, more or less 30 seconds, what would you like us to take away from today's webinar? Mohamed, you can start and pass the baton to the panelists of your choice.
Thank you. I think immunization is investment. It's a humanitarian investment. I think everybody should invest in it. You can spend some time in advocacy, or donate in money, or volunteer in the vaccination activities. I think it's very important to invest in immunization. Thank you.
Mike, do you want to go next?
Yes, thank you. Thank you very much. I think building on what Mohammed has said, immunization is an investment. And then as you invest, then appreciate the context within which you invest, because there are political factors, There are structural factors that influence even the efficiency of the return that you expect. Yeah. So appreciate that there's politics, appreciate the broader public finance context and the structural realities within the context. Over and thank you very much.
Thank you. Debbie?
I would say immunization is collaboration. Everybody needs to collaborate together to make it a success. Continual advocacy, continuous campaign about the importance of immunization. Everybody should be involved, both young, old, children, everywhere. There should be advocacy because prevention is better than cure. It's better to prevent a disease than it's cheaper to prevent a disease than curing it. So everybody should be involved in immunization program, advocacy, campaign awareness. It should be a collaborative work within the community, the country, within everybody should be involved in immunization programs and advocating for it. And encourage all the caregivers in their communities everywhere the importance of immunization and to bring out their children for immunization. And immunization is cost-free. It is not expensive. It doesn't cost anything to immunize a child. Thank you.
Thank you. And Rita?
I would definitely echo the panelists, and Gavi, now we're preparing our strategy, a new strategy that will start in 2026. So it's really important to keep immunization at the core of our work. And basically, we have been playing a role in addressing current and future challenges, maintaining, pushing further on progress, working in routine immunization and outbreak response, strengthening health system, regional manufacturing are all increasingly relevant in the world of polycrisis, including climate change and the rising threat of outbreaks and pandemics. So it's really important we have started our replenishment. It's really important for us to make sure that the strategy that will start in 2026 will be able to reach all missed communities and reduce, and basically we no longer have zero-dose children, and this is the last strategy period before 2030 to deliver on SDG 3. Thank you.
Thank you very much. So thank you all for sharing your knowledge and frankly for inspiring us. So today we were reminded that while conflicts are increasingly frequent and that some communities still can't access vaccines easily in times of peace, with the sufficient support from Gavi and the Global Polio Eradication Initiative, partner countries and health workers can save lives and reach every child with vaccines. And even in Canada, there's a lot that we can do to show our solidarity, and you can start by taking action now. In the chat, you'll find a link that will lead you to a message to share on your social media. You can see it now. Yeah. So Canada has an opportunity to invest for our future and protect children against diseases like malaria, like polio, HPV, to only name a few. How? We believe that the best way for our country to do this is to pledge at least $720 million to Gavi and to continue to support the fight against polio by committing $150 million, to the Global Polio Eradication Initiative. So thank you, Debbie, Mike, Mohammed, and Rita for joining us today and sharing your expertise with us. And thank you all in the audience for doing your part and mobilizing for global access to vaccines for our future. Thank you and have a great day or night.